We should be doing it. We made the mistake last year when we were dithering around what to do, and finally we ended up with a lockdown over Christmas. And my fear is that without Plan B, we'll end up with a lockdown this Christmas. So what I'd like to see is to avoid the lockdowns. But if you don't, in the words of Sir Patrick Vallance, the Chief Scientific Advisor, if you don't hit early and hard, you miss your window. And at the moment, you're talking about infections have been going down slightly, but we're still 10 times more than Italy, 7 times more than France. Germany has got a third of our infections. We're not doing very well. And if we don't do something dramatic now, then we'll pay for it later, and it'll cost an awful lot more than 18 billion.
So that's a yes from you. Peter, I want to just bring you in, because former Labour list, we've seen Keir Starmer now finally have an opinion on something. His opinion is on this, yes, we should be doing it. Should we?
Yes, I think it's very likely, and I think there's a lot to be said for it. To be fair to Keir Starmer, he called for a lockdown last November time. The government eventually did it, so he's had several opinions, and I won't rehash Labour conference. I think the government is wrestling with itself because it's got its right-wing libertarian ideology. It doesn't want to restrict freedom. No one should care about that. Not care about libertarian values. I think it's wrestling with the economy. That's a serious point, because recession costs lives, costs jobs, costs housing, costs health. And then also think it's worried about the polling and the political impact of another lockdown. As Nigel said, last year, the problem wasn't that we had a Christmas lockdown. It was yes, no, on again, off again. And then finally, as everyone expected, lockdown was brought in at Christmas. So I think what the government needs to do is act with clarity, take the politics out of it, and this sounds old-fashioned now, a year into the pandemic, carry on listening to the science, because I'm not sure they are.
Right, Ella, I hope you're going to speak some sense. I'm pinning all my hopes. That's why I've come to you last. I like to hold the common sense until the end.
Well, it's a bit too generous, but I completely disagree with both my fellow panellists, because we know that, and talk about listening to the science, we know that at the moment the people who are suffering from very bad illness and unfortunately who are dying are those who haven't had, in the most part, are those who haven't had the vaccine, or indeed people in the vulnerable or elderly group who haven't had their booster yet. So I would not implement Plan B, but what I would do is urge the government to really put the gas on when it comes to continuing to push the vaccine rollout. They've kind of taken their eye off the ball on that. We've had problems with rolling out the booster jabs. We know that is the most, and particularly the booster jab being a very high percentage effectiveness of preventing very serious illness and indeed having a large effect on transmission. Why aren't we talking about the success of the vaccine any longer? We seem to now have reverted to this very lazy approach, I have to say, that the government has, whereas when in doubt, go for a coercive measure. I can't stress enough. I mean, I disagree with Peter on the idea that the government's got a kind of right-wing libertarian bent. I think, if anything, the government hasn't respected the principle of freedom enough. You know, how many times do we have to list things like the massive waiting list for cancer treatment, the horrendous situation that continues to happen in care homes in relation to people not being able to see their family members, dementia patients deteriorating, you know, people losing their jobs. People think that the furlough scheme and working from home was some kind of holiday for most people. Well, actually, it was most people's personal hell, juggling childcare and your job working on Zoom. You know, all of what happened in the last 18 months was a serious thing that was, you know, in the context of an emergency and a virus that we knew nothing about way back in 2020, was acceptable, and lots of us accepted it, and there was a high level of support for the government's measures, and people understood that. But now, when we know all that we do, and most importantly when we have the vaccine, the idea of reverting back to, you know, things that sound frivolous, like mandatory mask wearing. People say, why would you be so bothered about wearing a mask? But social distancing, you know, being away from each other, and in particularly working from home, which has a knock-on effect of city centres, it has a knock-on effect of people's mental health, you know, we know all of this. Bringing that back in is no small thing.